It is pretty common for me to be asked questions about medication use in kids with OCD and anxiety. It could be the kids or the youth or teachers, nurses who may have questions. And something that some people find surprising is that there is good evidence for medication use in kids with anxiety and OCD. And certainly while cognitive behavior therapy is the mainstay of treatment, very often kids need more, or youth may need more to help them if they have moderately severe illness, and there's good evidence for this. So the main treatment groups or medication groups that are used are SSRIs and SNRIs. Some of the side effects that are involved with both these medications might be, initially there could be stomach upset, diarrhea or constipation, so kids may have difficulty sitting in their seats or want to go to the bathroom. Sometimes it can cause sedation, so making them sleepy in the daytime. It also might cause insomnia at night, meaning that they don't get as good enough sleep so that the next day in school they may be drowsy. At higher doses it can cause tremors, so there may be a little bit of movement. You can see complaints of headache. One of the side effects that has really been in the media in the last decade or so is the potential for suicidal thoughts in kids taking these medications, and that can often be a big worry and may prevent parents from allowing their kids to be medicated. However, it's important to understand that there's not a side effect of completed suicide or suicidal attempts. At times the kids may be a bit more activated, so meaning they may be more active than usual, especially the younger kids who are on these medications. But very often, anytime we prescribe a medication, you have to weigh the potential benefit against the risk. So if a child who is very disabled by their OCD or anxiety, then the chance of a bit of tremor or gastrointestinal side effects is often outweighed by the potential benefit. So in terms of questions that come up from other clinicians or parents, or in terms of specific things about these medications, they're not like taking a headache medication that would start working within an hour or two. And that's something that's really important to explain, that they take several weeks to take effect. So for the SSRIs, there's about 50% of their total benefit by about 2 weeks. With the NRIs, there's less than half of their final benefit, even out at 2 months. So if a family or a youth or a child is starting to take a medication and after a few weeks they feel like, oh, there's no change, that really doesn't mean anything in terms of the final effectiveness of the medication. So with these medication approaches, you often need to go to higher doses for treating OCD in particular, and need to wait at least 10 to 12 weeks before you can decide that the medication isn't working. Another thing, there's an older fashioned medication, we call it. It's called clomipramine, and it is proven to be somewhat better than SSRIs in the treatment of OCD. And that's a medication that not a lot of people are used to prescribing anymore, but it can be really beneficial.